think it's time we rise up, people. It's time's up, people. You can talk all you want, but it won't change a thing. I wanna know what you do. Welcome to the Up and Up. Thank you so much for joining us today. I'm very excited to have Shelly Carter. She is one of the organizers for the Detroit March for Medicare for All. As you know, we have the Washington, D.C. March that's happening. That's going to be the big one. And then we also have, I think there are, Joy just told me there are 38. And by the time this airs, there are
39.
Probably more. Okay, there you go. 39. It's growing
Yes.
all the time. 39 cities around the country that you can join into this. So Joy, I'm so excited. So you're planning the Detroit one.
Yes. Yes.
So tell us, first of all, tell us a little bit about yourself. I'm sorry, I don't mean to jump ahead. Tell us a little bit about yourself and kind of how you came into this.
So I came into this with like 7 people in the beginning back in January, and we're like, let's have a march. Let's have a march for Medicare for All, and we'll just throw it out there. Show people how, because we're like, we can't be the only 7 people in the country that want it. Obviously, more people want this.
Oh yeah.
And with like 39 events, I'd say we were right. So that's kind of how I got started. I was originally got in contact with Sharif about direct democracy, and that's how I sort of got involved with this, and it just kind of grew like one thing to another. Like I think it was almost 8 weeks ago, Sharif asked me to do the Detroit Medicare for All March, and since then I have met so many good people. I actually have my co-host. His name is Rome. He goes by Unholy Rome on Twitter, and he's a Detroit organizer, and he's helped a lot with the connections that I've made in Detroit. There's a lot of mutual aid, and just I've met a lot of good people since then. So I was very, very excited.
Yeah, I was trying to remember the last time I was in Detroit was for a Center for Popular Democracy event, and I remember I wish I could remember what was the organization that was in Detroit that was just amazing. Like I wish that's gonna get on my nerves. I can't think of it. Anyway, when I think of it, I will. So are you actually from Detroit, or are you from like outside Detroit?
So there's only one Detroit, and that is the 313 area code. Everything else is Detroit metro area. I'm in the Detroit metro area. I'm actually just north of Pontiac. So
awesome. So tell me about the event. What do you guys have planned?
a barbecue.
Okay.
We're gonna do a barbecue, and we're gonna do a virtual watch party. So for people who can't make the event, or if a speaker can't physically attend the event, they can be there virtually, or attendees can be there virtually. Yeah, but no, we want to have a barbecue. I have not been the greatest at getting the locations, so that's been more Rome's area. I know it's over by 7 Mile and Hayes.
Okay.
I know that. I don't know the name of the location, but I know it's over by 7 Mile and Hayes. I know that we are trying to do healthy foods and focus on the health aspect of it all, and put up like donations, because a lot of places that do mutual aid, we're trying to get them involved. So we'd like them to put up like a donation box for like the food pantry, or for clothing, or sound system, or anything people really need, even if it's just like water.
Yeah.
So we'd like to put out some donations, and let's see, other than that, the virtual side of things is we're just gonna stream. I think there's 11 slots, and we'll just have people submit questions to the speakers, and we can answer the questions and just kind of have a good day of it all.
Yeah. So who's speaking? I heard Dr. Abdul Sayed is going to be speaking. Am I right?
He is not yet confirmed, but
Oh, okay.
he is one of our. I've been trying to talk to him. We really want to get him really bad, and he might be one that might have to be virtual, but I have not heard back from his assistant yet on that. We've had a bunch of other people trying to get him as well
I feel like you
to
really
come to
should. I mean, I
us.
literally have his book on Medicare for All in the other room. I haven't read it yet, but it's there. But he
He
literally
should.
wrote the book on Medicare for All. So I'm hoping.
Yes. He's an evil genius mastermind that I would love to have there. Dr. Dooley's our keynote speaker.
Dr. Dooley.
Yes, and I know she is
Okay.
really pushing hard for vaccines right now.
Yeah. I love her.
We have Rome Bethea, which is Unholy Rome, and he's going to be our MC for the event because I don't do a lot of public speaking. So he's agreed to do like the host, the introductions, and speaking and all that. We also have Mike Tilbred. He is an economist from Michigan and he ran for office. He can, and he's sort of been battling the healthcare insurance company for 30 plus years. So he has some amazing insight and he has some amazing information and knowledge that he's collected. So he's a good one. And I'm also trying to get a director from one of the free clinics down in the Detroit metro area from Ferndale to come speak. And I think that'll be a handful.
Yeah. I mean, it sounds like it sounds like an all-star lineup as far as I'm concerned. So that's really cool. So let me ask you real quick. I'm like, I know that everyone, virtually everyone has a story, and if they don't, then they eventually will. So my question to you is kind of, what specifically brought you to the fight for Medicare for All? Like, what is it about it that makes you really passionate about it?
I've had a very unusual relationship with healthcare my whole life. I have epilepsy, but that's not really the reason I would want to do Medicare for All. I've grown up sort of in the healthcare system, both for myself and just as my family. My mom worked at the VA hospital growing up, so I would volunteer there a lot as a kid. I'm very familiar with their practices despite never actually being in the military. So have a very good idea of how socialized medicine could work.
Interesting.
In fact, when Obama said that, hey, we're going to do universal health care, that's what I genuinely thought they were going to do, would just open up the VA hospitals to everyone because they are federally run hospitals, or at least give everybody the federal health care that I know every federal employee has. At least at that time. Now I believe they have some loophole stuff that's horrible compared to what it was before.
Right.
So, I mean, I either feel like they shouldn't have touched it and just left it the way it was, or did the right thing and fixed it to what it could have been. But now that they've touched it and somehow made it worse than what it already was, I just sort of feel obligated knowing I have a solution to at least see the solution to the end, because they are not going to actually make it better. They're just going to exploit it like they do everything else.
Right.
So, yeah.
Yeah, I totally hear you. I think that it's really sad. What ends up happening is, as in everything, right? What ends up happening is that, corporations and lobbyists and get in the middle of it and then screw up what would be a good solution. And we, the people, are looking at it and saying, no, it's simple. We do this. We already know how to do this. We've seen this, we have examples of this. This is what we do. And instead it becomes some monster that just profits, some the healthcare industry.
And I know like a lot of people can do it and make it personal because healthcare is personal and it's their job and it's personal for them too. But like from just a professional standpoint, if like you can't do your job because of the system. We just need to change the system so the job can get done. Because it's not even the matter of if you can or cannot do your job. It's the matter of, are you able to, with the system in place and going over a year of evidence from just one disease, it's sort of proven that the system doesn't work and the structure of the government doesn't work the way it needs to address the people's problem. Like,
Yeah.
we could just basically advertise that am I allowed to swear in here?
Yeah, go for it.
Okay, I wanted to ask before I did. Like, we could basically just say that the US government is just like 500 corporate bitches lined up. Like, we could say that, and it wouldn't be a lie. And it wouldn't be a lie because they're bought, they're paid for, they're used pretty generously, used a lot to get done stuff that has nothing to do with what needs to be done
Right.
when it counts. Like if they were doing that stuff along with doing the stuff that needs to be done when it counted,
Yeah.
okay, that'd be one thing. But they're not doing that. They're literally just one agenda and then they're gone. That's, I guess, sort of why Edie put me in contact with you and to talk about like one of the solutions that we are considering. I don't want to say we've considered or decided on, but we are considering to do for, in case when they do say, no, we will not give you Medicare for all on July 24th. No, we're gonna just go back and enjoy X, Y, and Z. So we have 3 decisions we're considering. We have a pledge for them to take. We have 1881A, which is a bill that allows emergency access that just requires a signature, either executively or through Congress, however they want to do it. I would prefer Congress so another president just doesn't get rid of it. And or direct democracy, which is my approach and sort of what I've been studying up on ever since COVID happened. And I just stayed home and I was like, hey, this is what I'm gonna study.
Well, thank you so much for coming on. I'm really looking forward to this. It's going to be absolutely amazing. Now we actually have another organizer from another state. This is Heather Stockwell. You've seen her before. She's been on the show before to talk about her work with RAD New Hampshire. It's Rights and Democracy New Hampshire. Welcome to the show, Heather.
Hey, Jodi, thanks for having me today. This is great. Really pleased that you're doing these interviews.
Yeah, I mean, just trying to build up as much momentum. I think that, if we, it is what we make it, right? If this March really turns out to be a good showing. So I'm doing everything I can. And I know you are too. What I think is really cool about it, so we just spoke with Shelly, and she was talking about the Detroit March and what they're doing there. And they have some kind of unique spins on what they're doing. We see the same thing in New Hampshire. It's sad because I volunteer with Rights and Democracy New Hampshire, but I'm going to be
That's right.
I'm going to miss you guys. But I do work on the health, volunteer with the healthcare justice team, which you lead, Heather. And what's really cool is that this March has kind of come into line with the work that we've been doing. So I'd love for you to kind of tell us a little bit about, let's start with kind of what we've been working on.
Well, I think one of the big things that we've been talking about is a corporate accountability campaign that we've been working on with some other national partners to make more impact, right? And that's called Care Over Cost. Anybody could look it up online in any state that you're in across the country. It's careovercost.org. And it is corporate accountability really for Blue Cross Blue Shield or Anthem or whatever it is in your state. It is one of the largest providers across the nation and was one that have record profits and sometimes even monopolize a whole state's like in New Hampshire, pretty much monopolize our insurance providers system. There's not very many choices for us in New Hampshire except for Anthem, Blue Cross Blue Shield. So what we're trying to do is really call them out on their games. Basically, we have some of the highest rates of for insurance, health insurance in the state of New Hampshire. in 2018, I believe it was, all the insurance rates went up across the country by 25%. In New Hampshire, we went up 45%. This is right in our insurance provider's report from that year. It's shocking, but it's right there in the print. And while I think the rates did go down this year, I would say probably because of COVID, it's not a lot. And what we're really focused on is the denials. I'm personally experiencing that in my family, that we have a denial. We have Blue Cross of Vermont, and it's when you look at their annual report and they're making 32 billion, and we're arguing over a $6,000 bill that they're refusing to pay, it doesn't really sit well with me, from a personal perspective, but also just as a moral perspective. So that's part of what we want to talk about that day is trying to hold them accountable. And we might escalate this in the future if they're not really hearing us, I guess. Yeah. So we're going to rally. We're going to bring the rally to them. We're going to tell stories. We're going to hear some great speakers and make some noise, and sort of let them know, put them on notice that we are paying attention.
Yeah, absolutely. And I love the idea of really tying this into existing work. I mean, this is something that this isn't something that just happens one day a year. There are a lot of people who are working on this on a regular basis behind the scenes, or putting together these campaigns and whatnot. It's interesting. I have Blue Cross Blue Shield. I have it through my work, so I have to. But even the healthcare story I had shared before, where exactly what you're saying, they denied my my claim for my surgery. They denied my kids' annual checkups. Like it's like what is wrong with you? And then you have to go through this whole. I mean, it's hell. I didn't think it was even going to get paid $7,500 at the end of the day. I didn't think it was going to get paid. And if I didn't have people really backing me up and fighting for
me, it takes work, and that's just it. I mean, so many people don't have the wherewithal, or might be ill and can't, or they're working so much to pay those premiums that finding a time between in their work day to make that phone call and to keep fighting for them to pay it. They're just either paying it if they have the money, or letting it go to collections. And so that's something that I really think that we should be talking about more in the whole healthcare conversation, is like this crisis that we're in. I'm calling it a crisis. It's literally ruining people's credit and ability to live.
Right. Yeah, absolutely. I think there are a lot of things that, happen as a, kind of, what do they call it, as a windfall, or, just as these consequences play out. It's really devastating for people's lives, especially, I mean, we talk about financial, but how many other aspects of your life does that impact? Right.
Right.
So let's talk a little bit about exactly what the format of the march is going to be. So you're meeting. This is in Manchester. So just so people know, the capital of New Hampshire is Concord, but it's not happening in Concord. It's happening in Manchester, which they're only like 20 minutes away apart or something.
Right.
But it's happening in Manchester, and it's happening in Manchester for a reason. So tell me about exactly, what's going to happen at this march.
Well, yeah, I mean, a couple of reasons that we chose Manchester over. I mean, we had considered Concord at first, and in our conversation, I think you might have been at that meeting with the healthcare team, where we were like, do we do this in Concord? And then we're like, the state house is going to be out of session, so nobody's really there to bring it to. And Manchester is the most that has the highest population city in New Hampshire too. So there's going to be a lot more impacted people there, and that's one of the reasons. But also the Anthem Blue Cross building in New Hampshire. We don't have a lot of big buildings in New Hampshire, but you got to go to Manchester probably to find some of those. But we really want to bring the fight straight to them on some level, not that we're going to physically be fighting them. So yeah, that day, our plan is, although I realize I didn't get the permit, that I guess you need one to meet in a public park. I just thought, it's a public park, we can do that. So the plan is to meet in Pulaski Park. which is just a few blocks away. I think it's like 2 to 3 blocks away from the Anthem building. So we were planning to meet up there and have like the planned speakers that I've been working on getting there and prepared to say something that day. And some of them are state reps. We have a doctor. I think we're going to have a med student. We have an individual with cerebral palsy, and probably a couple others. We've been working with a lot of state reps to try to pressure our delegation, because in New Hampshire, none of our delegation are co-sponsors of the bill. So it seemed appropriate to put pressure on them in some different ways, and from some different groups that aren't necessarily sort of organizing around Medicare for All, to give them a little bit of momentum or direction towards that. So yeah, so when we get so we're going to march down to the corner. We're going to make a lot of noise, chanting and waving our signs. And then when we get down there, we'll have a portable sound system and we'll open it up to others who want to share their healthcare stories that day. Because really what we want to do is create, and build a community of people who are willing to share their stories, because you've been in a lot of those, meetings with delegation members, our federal delegation, and, or their staff. And those stories can make such a huge impact on them. And when they hear such a sort of personal experience, it can really change their mind, or make them look again at how they're viewing the world or things on this issue.
Yeah. Absolutely. I think another thing that stories do, at least, what I really appreciate about them, or one of the things that I really appreciate about them, is that when people speak up about what they're going through and what they've gone through, it makes space for other people to do the same. And it helps other people to realize that when you think that you're kind of suffering in silence, like you're just kind of doing this is something that just you're going through,
nobody else is going through.
Yeah. And it's like, no, actually everyone else, all of these other people are going through it as well. So yeah,
we're also hosting next Wednesday night before the rally, and we'll have some more of these, maybe even on a monthly basis for a little while. To try it out. We're having a healthcare listening session on Wednesday night, where we're inviting people to come and talk about what they're going through, and to help them develop a story around it. Because so many people tell me that they don't have a story, and then pretty soon they're just telling me their story. And I'm like, no, you have, you do have a story, you just have to sort of tease it out, if you will, or sort of think about it maybe a little bit more intentionally.
Absolutely. Well, that's awesome. I'm really excited about it. I'm sad that I'm not going to be there, but
Me too.
but I'm really excited about it. Where can people find information? Obviously we have, it's on the main, marchformedicareforall.org. You can find each individual, click on each city where it's happening. So you'd find Manchester, New Hampshire, right?
Yep. If you go for the m4all.org, we're listed on the, under Manchester, New Hampshire. We also put up a Facebook event. So it's, co-hosted by us, Rights and Democracy. And I think our Medicare for All New Hampshire page is on there. And the Granite State chapter of PNHP is also a co-host of the event. So that's exciting. Oh, and Southern New Hampshire DSA has come on board too. So that's exciting. We have a little cohort of us. I just realized, New Hampshire Youth Movement is probably with us, and would probably love to be a co-sponsor too. And I'm just thinking about it just now. So, but the more the merrier. We really know we need to come together on this, and just keep telling our stories, and keep demanding for a better system, because this is, I actually said to myself this morning, I feel like I'm in an abusive relationship with my insurance provider.
Yeah. It really is.
And I'm still in it. I haven't broken up with them yet.
Yeah. Well, you know what? That's the thing. I mean, it's your,
Happening.
it's the conditions that are set, you know what I mean? That make it, you know, for you to have, like you said, they have almost a monopoly in New Hampshire. And it's like, what else are your options? You need care, and this is our system. So,
Right.
you know, at the end of the day, we all have to come together and change the system if we're going to get out of this abusive relationship. So,
Definitely. You know, there's also, I just want to mention quickly, like there are other things that we can be doing to get to Medicare for All. And that's one of the things that I've actually been, you know, I know there's probably tension around this too, but one of the things that I'm really excited about is Bernie's Medicare expansion bill. Well, it's not just Bernie's, but Medicare expansion could be a real game changer for this fight, I feel like, because it would begin the process. And, you know, for those people that really like to see incremental change, I feel like this is a great step, because it would really illustrate what would happen if we improved Medicare, which is, you know, for some people, I think a problematic name. I'll just say that, like, but it's also a really popular program in the United States, even with all of its problems, right? But the Medicare expansion bill would improve and extend the age groups that it covered.
so
And
exactly what, so like what age,
yeah.
things like that. And this is
Well,
to
there's been
include
a number of, I think there's been a number of discussions, and I think it will all, you know, end up getting negotiated, of course, on the floor. I think that Bernie's original proposal was to lower it down to 50, and even include young people, you know, like whatever 1 through or 0 through 25 or 26 or whatever it is, which actually, you know, from what I hear from folks, is wouldn't actually cost that much, because of course young people in general aren't getting sick as much or going to the doctor all the time. So it would really be a great help to start some of those folks, or all of those folks, off with a, you know, a solid foundation, getting their life started as they become adults and want to, you know, be a part of the world that we're in. But you know, for someone like me, I'm over 55. So anyway, 55 was another cutoff point that I've heard discussed. You know, if something like that were to pass, I realized, you know, how much would change for me and my family, is that all of us, you know, if young people were also included, my whole entire family would be covered under that program. And that would change my life immensely, because right now I pay more than my mortgage for the rest of my family's healthcare. Like I get my healthcare through my job at RAD. But in order for me I have to purchase it for the rest of my family. And it is a chunk of change. And to be denied some of the care that we need on top of paying so much is really outrageous to me.
Yeah, absolutely. And so, I mean, I think kind of the idea is, you know, I mean, you say incremental. When we talk about expanding it, so say it did start at age 50, right? If it does start at age 50, then those people who are 50 to 65 are realizing, you know what I mean, how it is. And it's interesting that you say that the name is problematic. I mean, Medicare, I think, as far as I know, it was originally a lot better and then was kind of chipped away at and changed,
Yes.
and pieces of it privatized. Another organizer who I met with a few weeks ago was talking about how her father is on Medicare, but it was the difference between, you know, kind of getting bounced from, you know, one thing to his supplemental, and, you know, these
Right, you have to get the supplemental.
and then you end up you know, getting lost in the crack, you know, whatever, and things like that. So it's been complicated. I think the reason why Medicare is problematic for some is because of the complications that have happened.
Right.
You know what I mean? So,
right. And that's some of the work that we're going to be diving into also in the next few months, is talking to more people that are on Medicare already. We've done some work around Medicaid, talking to folks that have Medicaid. But, you know, a lot of folks that, like, especially in the disability community, are on both.
right.
They're on both Medicare and Medicaid. So there are some different experiences there. But I do often hear that from older folks that are on Medicare that are like, well, you don't know because you're not old enough yet and you don't have health issues. And I'm like, well, I do actually have some health, we all do. I think especially as we start getting into our 30s or 40s, things start to arise, right? It's just the natural cycle of life, right? Like, but I think that's going to be important for us to start having those conversations because we haven't really improved our Medicare system. I'm trying to think, have we ever actually improved it? We've made some changes, but I'm not sure, as you said, if we should call them improvements.
Yeah.
And it's definitely high time. I thought it was, well, years ago, but certainly, it could really, that expansion could really change things for a lot of people, and especially where we're seeing one of the latest reports out that cancer diagnoses at the age of 65 are like jump way up. We now know that that's because they've been holding off to get the care they need until they're on Medicare.
Right.
So yeah, and we have the anniversary coming up next week, by the way. I think is it the 29th or the 30th, next Friday, I think it is.
The anniversary of Medicare being
Medicare.
Yeah.
What a great birthday present that would be for Medicare.
I know.
Let's improve you. Yeah.
Awesome. Well, thank you for coming on to tell us. Do you have any last words? I don't know where to go.
Sign up and come on out. Sign up and get all the details on the March for Medicare for All page for Manchester or whatever state you're watching from. Go to a rally and get involved with some of the folks that are, on the ground there and helping organize it. You'll feel better. You'll feel better if you do that. Getting involved is good for the heart.
I agree. Absolutely agree. All right. Well, thank you. And thank everyone for watching. If you want to get involved, march for or M4 all .org and find your closest city or come to DC and see me. I'll interview you. That'd be great.
Right.
All right. Thanks.
So
everyone.
cool. Thanks for having me today, Jodi.
Yeah. I'm glad you could come on.
Yeah. Thank you.